All right, so for the next technique that we're gonna do, we're gonna be working the IT band. And what happens a lot of time is that the way that I'm asking you to be on the roller is a little different than most people. Most people actually turn their body or their tube long ways on the roller, and we see them rolling like this. That's where the pain comes from, is because there's such a small part of your body on the roller and it just can't handle that. So when we switch people to this position, the common mistake that happens is that people actually slide their body trying to slide on the roller. That's not what we're trying to do. What we're doing, and which is what makes it kind of complicated, is that we're a tube on a tube, much like a hot dog on a hot dog roller, where it stays in the same place. And that's what we're going to be doing. So we're going to start on top of the roller, laying on it like this, and then nice and easy, we're going to roll our body slowly. So we're rolling on the roller and we're not sliding off of the roller, okay? It's that same technique when we were working the back earlier. It's the same thing. We're rolling our whole trunk or our whole torso. We're not sliding off of the roller. So important to make sure that it's gonna take a little bit of practice, but once you get it, this is gonna make all the difference in the world. Okay, now we're going to the dreaded IT band. This is the area that almost 100% of people will say that I hate the foam roller because I tried it on my IT band because that's where all my pain is, in my knees and my hips, and it was so painful that I just couldn't do it, so I don't use the foam roller. We're going to show you a non-painful version, and this is going to change everything for you. Your range of motion, your flexibility, pain in the knee, pain in the hip, low back pain, neck pain. Along with the pelvis, this IT band and the lateral side of the musculature through here, when it gets too tight, it tends to draw the legs wide and jams the legs into the hips, which then tilts us forward, and it creates a whole slew of structural deviations. So I'm going to show you a non-painful version of the IT band. So instead of laying on it long ways like we would normally see, so guys, go ahead and get on it how we would normally see people get on it. They turn, they lay this way, and then the next thing you know, we see people scooting really fast through this foam roller. They're kind of in a side plank position, and they're crying, and tears are hitting the floor, and there's horrific screams coming from them. So we're not going to do it that way. The way we are going to do it is we're going to turn the roller long ways on our mat, and we're going to lay on the roller long ways. This one technique is going to change everything for you in regards to treating this IT band. The other thing that happens with this IT band in the quads is that much like the back, tissue comes away from the spine, the musculature in the legs gets rolled too much to the outside. So the technique that we're going to utilize to put all this tissue back where it's supposed to go and really lengthen this IT band is we're going to roll from the outside back to the middle to put the legs where they're supposed to go. Now it's important that when you get on the roller that you're all the way on the roller from your knee all the way up to the hip. So we're going to have Christoph scooch up so his knee is all the way up on the roller. Keep going a little bit more. Okay, with the top leg, what you're going to do is you're going to make sure it's around to the front. The foot is on the ground to give you some stability. That's going to make sure that you don't fall over. If Mary Kate were to stack her legs, it's going to be really easy for her to wobble and fall off. So she's going to bring that top leg around to the front. That's going to relax and still her whole body. Now what they're going to do is that they're going to roll their body on the roller. So they're going to start right on their side, and their belly button and their torso and their hips are going to roll down to the floor. Slow is the key. It's very important with this one in particular that you're going slow. If you find that it's painful at all, you need to slow down just a little bit more. And then if it's still too painful, we're going to come to our handy dandy towel. Take that towel, fold it in half, lay it right on the roller. Exact same technique. The next thing you know, we have a nice soft roller we're working with. And some people like to buy some of the rollers that are a firm density, and I can't tell you that that's the best thing for most people, because again, most people are already in pain, and using that hard firm of a roller is just going to make things really uncomfortable. You can see how they have both hands on the floor, and actually this backhand, if you put the whole forearm on the ground, that's going to give you a lot more stability as opposed to trying to lift yourself up real tall. The more relaxed and straight we have the spine, the better off you're going to be. Same thing over here. We're going to have Christoph move his front foot forward a little bit, give him a little bit more balance, and then nice and easy, we're just going to roll from the side around to the front, steamrolling all that tissue back to where it's supposed to go. Because again, the quads or this front group and the IT band get migrated too far to the outside or laterally, and we got to reposition that tissue. Okay, so what we're going to do now is we're going to work our IT band and our quads with that variation. This is also a great way to practice learning how to roll your body on the roller. So the back technique on the wall versus on the ground, doing this on the wall first, this is a really great way to be able to get good at learning how to balance yourself on that roller. So all we're going to do is we're going to take that roller, put it against the wall. I'm going to lean against it. I'm going to put the side of my body on that roller, making sure that the roller is going below the knee up to the hip. That's crucial because that's the length of that IT band, as it goes from my knee and inserts down below, or from my hip down below the knee. So all I'm going to do is I'm going to start with my belly button facing away from the wall, and nice and easy I'm going to lean into that, and I'm just going to rotate and turn. And the more I push into it or lean against the wall, the more pressure there's going to be. And I'm just going to roll towards the wall this way. So again, we're going to reset. Here, you're going to have to play with your arm on the wall just because that's how that's going to have to work. I'm going to lean against, and if I don't want that much pressure, I just come a little taller and don't lean so hard. So I'm going to lean against that roller, nice and easy, sticker slow. I'm going to rotate my belly button and my chest towards the wall this way, and that's going to start to work that IT band. And it's going to begin the work for those quads, working through there. Nice and easy, coming over and through. And that's going to be our variation for our IT band technique.